Good afternoon, everybody. Resident rights and abuse, and I have a movie to play. It's kind of older, and I believe most of you have seen it many times in the past. It's dated, but it covers every topic. One thing that has never changed has been resident rights. It was established in the 80s, and they pretty much stay the same. The only thing that will change is how adapting with the times and the changes that go on with just the evolution of human life and nursing in general. The one thing that I definitely want to express that isn't in here is if you see any type of abuse, anything that makes you feel kind of like, did they say something funny? Did they do something funny? Something that makes you feel very uncomfortable. The steps and procedures that we want to follow is, let's say that you are my patient and I have said something very negative to you and you notice it and you feel very funny about it. The first thing that you want to do is you want to ensure her safety. You want to ensure that she's safe and that I am, you have put a safe distance in between me and her. And then you want to go and you want to find a charge nurse and you want to say, hey, I need a charge nurse to come here and examine this situation. And they will check her out, make sure that she's okay, make sure that whenever you weren't noticing that I wasn't physically, abusing. And so they will start the process, and how the process is just like anything. It's with chain of command. So the charge nurse will initiate, they will come to me, they will start the process with me, I will start the investigation, and I will follow through going to Rainey and then on to Steve and up to Rob and to Kay from that point. If somebody comes to you, let's say that she didn't feel comfortable, that this had been going on with me for quite some time, and she wanted to, lodge a complaint. There are forms that people can fill out to say, I have an issue and I need to escalate this. Patrick has those forms. And also right outside my office on the red board, there are numbers if people want to call. If say they don't, feel comfortable saying anything in here within our facility, and they want an outside agency to be able to come in and say, hey, help me do something here. I don't feel comfortable saying anything inside the facility. They can call the ombudsman or they can call the regulatory facility, which is CMS, and they can get a hold of somebody who can come in and they can lodge a complaint, have somebody to speak to, have somebody to kind of say, help me work through this process. And with that, I'll go ahead and kind of go on into what their rights are, some things that none of us are violating, but kind of what their rights are that we definitely want to, as a group, look at and make sure that they are getting their rights taken care of. Do I just push play? And it isn't very loud, I'm sorry.
Well, that was it, guys.
There you go.
Life is unpredictable,
This is my home, away from home.
when change is part of our everyday life.
You expect people to respect you and your things as just like you were at home.
I think the main goal is to make sure that each resident has the opportunity to stay in control of their life for as long as they can.
You need the people to respect your dignity, and we're all individuals.
At the time of admission, every resident and resident representative receives a summary of their rights protected under the law. And before beginning work, every new nursing facility worker receives training on residents' rights and the policies and procedures the facility has in place to protect them. It's true. Most of these rights have been the law of the land since they were created in 1987 as part of a law called OBRA 87. But the real-world challenge of putting these rights into practice is constantly evolving. That's because the world in general is changing, and the makeup of our staff, our resident mix, and the state of healthcare in this country are all very different today than they were 10 or 15 years ago.
I'm just going to go through the information packet that we give new residents.
So let's look at some of today's challenges where residents' rights are concerned. You'll hear some practical advice for keeping those rights at the core of everything you do.
We're going to raise this up a little bit.
We'll also share information on how to be prepared if someone has a complaint or notices a right that's not being honored. But first, let's review the basics. What rights are we talking about?
It is a tough job, and you have to respect their rights like you want your rights respected.
One of the major rights of the resident is to be treated with dignity, and for us that means that we need to train our staff to realize that each single resident that enters the facility is an individual and is entitled to dignity as they have lived in their own home. Treating people with dignity and respect means that we have to treat them as individuals, and we need to respect their privacy, make sure that we provide for a clean, safe environment with freedom from unnecessary restraints and freedom from abuse, harsh treatment, and neglect.
Another major area of resident rights is the right to be informed, to know what your plan of care is and what the physician is ordering for you, what the nursing staff and other providers of care are going to be doing as far as helping to make you stronger and healthier. It's the resident's right to receive the Bill of Rights from their facility. And it would be important for them to ask questions about anything that they don't understand.
Another big resident right would be the right for them to have choices.
Everything from what they choose to eat, to what they choose to wear, to how they look, to who they associate with.
They have the right to choose to decline services. They have the right to privacy of their mail. They have the right to maintain their own religious beliefs.
Choice just permeates every aspect of the resident's life in a facility, and choice becomes a key to their health care.
Dignity and respect, accessible information, and personal choice are the foundation for residents' rights. But federal and state laws also protect an impressive list of additional freedoms. For example, the right to have your health records and details of care kept confidential, the right to privacy while receiving care, as well as the right to privacy with one's mail, phone calls, and during visits with family and friends. The right to be in contact with persons outside the facility, such as family, doctors, friends, and advocates. The right to have personal funds and belongings protected, but available when requested by the resident or resident's representative. The right to have the facility follow correct procedures when it's time for a discharge, transfer, or change of room or roommate.
You have to look at each person in their own right. And, if you can keep that in mind and you work with that individual person, their own issues, their own, look at their own strengths and interests and help them from where they are at that particular time, you've come a long way.
And don't forget, nursing homes are surveyed or inspected regularly, with residents' rights being one of the key areas inspectors check. So you and everyone on the team need to make residents' rights and respectful care one of your highest priorities.
It just don't come every night. Yeah, you just have to, work with that and get those, that's what you call skills.
Shoulders.
You can't do that? Okay. Do you want to use these? Over the years, things definitely have changed. In the past, it was more facilities rights and not necessarily the person who was the resident who lived there. And so the change I see is that there is more emphasis on the individual who lives there, that they are the center.
The rights don't change, but the manner in which we continue to educate our staff have to change, because family members have different expectations, residents have different expectations.
And a lot of those expectations simply reflect changing times. But by keeping resident rights as a stable foundation, society can go ahead and make its own shifts without compromising daily care. The challenges change creates can be met by being aware and adjusting how work is done. For example,
we do have a real mix now of people in terms of English speaking skills, and so just the sheer ability to communicate sometimes becomes very problematic.
Many of our nursing assistants are immigrants, and for them this is a whole world change, a culture change, and they have to try to mesh their understanding of healthcare and elderly people into our kind of Western way of thinking.
cultural diversity makes a nursing facility, like the rest of the world, a richer, more interesting place. But it's important, as we give care, to respect the residents we're around. One way to do that is by speaking in a language they understand. That means not talking over them, or carrying on a conversation as though they're not there, or that they don't matter.
You probably don't understand what I'm talking about, huh?
Of course not.
I was talking yesterday, it was my day off.
No resident should ever be in the uncomfortable position of wondering, are they talking about me? Am I missing something I need to know?
See a movie with her husband.
By speaking in the resident's language and by making the effort to include the resident in conversation, we show our respect. It also means that residents and their families need to respect the diversity of staff and other residents.
See how many miles I became to United States.
Wow, you're a long ways from home.
It works both ways. The nursing care neighborhood is likely to become even more diverse as time goes on, and protecting the right to respect, dignity, and being informed relies on sharing a common language.
Years ago, hospitals would keep patients for extended periods of time, and the role of the hospital has changed over the years, where they discharge a lot earlier than they used to.
So when they tend to come here, they are fairly disabled, meaning that especially in our long-term unit, they're not ambulatory. They can do not very much to take care of themselves. And the people who have more abilities are becoming the exception.
I think it's important for us to realize that many of the people who come into skilled long-term care are vulnerable, and just because they're not able to speak up for their own rights doesn't mean they don't have those rights. In fact, it's even more important that all of the people who take care of them realize that they have rights.
You still have to tell them, okay, I'm going to do this or that, you know. I'll put this shawl around your shoulder. It's a little shield, okay? So at least they will know if I'll go enter a room and I'll start combing her hair and putting on her clothes, she will look at me like, what is she doing to me? She'll be very frightened. And a lot of times, though they have stroke and things like that, the way they look at you, and they'll nod like yes or no, you know. And by touching, they will know how friendly you are, how nice you are. Then you smile at them, you know.
We need to remember that a resident's right to dignity, respect, and freedom from neglect is not changed by their mental or physical capacity.
Gertrude, my name is Kendall. I'm your nurse assistant for today.
Someone else may step in to make decisions on the resident's behalf. For example, under a healthcare durable power of attorney. But whether there's a resident representative or not, the person's rights are still protected.
I think it's interesting that people who come here, as well as their families, have higher expectations, I believe, of a nursing staff than, say, 10, 15 years ago. In many ways, they're consumers.
And that creates difficulties, just in terms of time management, efficiency, being able to get your job done, because each resident individually requires so much more time potentially.
Where you been?
I've been busy.
When are you gonna take me to dinner? I haven't had no dinner yet.
Because already you got dinner.
You want to take me downstairs?
Yeah, I'll take you down.
You don't mean to be rude, but it just comes out. In a way, I think most of the time the patients have more right than us.
One way to protect residents' rights is to monitor your own level of stress. And the minute you find your own level of stress beginning to rise, first of all, be conscious of it, and then decide if you need to do something about it.
My mother was home. Oh, that guy stressed me out. It's hard to call him every 10 minutes. He can't give him any answer. He don't listen.
Go take your break for 15 minutes and I'll cover for you.
Oh, thank you very much.
One of the challenges facing CNAs is because of their own economic needs, they often have to hold down 2 jobs or a variety of jobs. And that means that when they come to work in the morning, they're not necessarily fresh. They maybe have been up all night, or they're starting the beginning of a 16-hour shift.
Sometimes we just need more hours in the day, more rest. We try our best.
Pace yourself. Not rush into things. And, that's, with the pacing yourself with anticipation, or something might happen.
Yeah, she's on Reglan. You started that yesterday?
Mm-hmm. And, if you pace yourself, you've done this, you've done that. If you have an emergency crisis, you can, go on from there and not, explode because of something that you really haven't done.
Given how busy the average nursing assistant is, especially on a day shift, finding the time to report to the nurses something that's of concern, whether it's a resident injury or bruise or an incident of abuse, it becomes more problematic because you're in your flow, you want to get XYZ done by a certain time. And yet, when it comes to something as serious as abuse, you really do have to stop, break what you're doing, and make sure that your supervisor is immediately informed that something has happened.
It was yesterday when I noticed the bruises on her arm. They weren't there. Yes.
A resident's right to live in a safe environment and be free from abuse and neglect should never be overlooked or put on hold because of workplace stress or lack of time. It's just not an option. Abusive behavior can happen in lots of different ways. It might be directed from a staff person to a resident, or it might involve a resident's behavior toward another resident, or even something a visitor does or says. Part of the job, even when you're under stress or have your hands full, is to be alert. And when you see something that violates residents' rights, you must report it to your supervisor.
When we first brought her into the room, it was a very nice room. It had all the atmosphere and everything of home, which that is how we like for it to continually be.
In most cases, protecting residents' rights goes smoothly, but there will always be times when questions, concerns, or complaints come up.
Then I had noticed when we came in one day that there was an odor in the room.
When that happens, having the right to speak up without fear and with the expectation of a fair, prompt response is protected by law.
So we went down to the nurses' station to ask them to come down and go over that with us, because that was not something that was a condition, an acceptable condition for the room to smell like pee.
They had the option to exercise their rights. And part of the exercising of their rights is to go through what we would call a grievance process.
Accepting complaints is part of an ongoing quality assurance program for every facility.
And we started down a process, a check off of, okay, is it the garbage cans? Is it something in the bathroom? What is it? Is it on her bed? And so through our process of elimination, there was pee under her bed.
I think that anyone who works with a resident, whether they're a licensed nurse or a nursing assistant, needs to have a good knowledge of what is the grievance reporting procedure for their specific role in giving care to that resident.
think that's just one of the things where we have to constantly be on our toes to provide quality care and assessment.
We were aware of at least 4 avenues to contact to try to get a resolution to our issue. So this is one reason why I believe that our issue was able to be resolved quickly and in-house, I'd say.
If an informal request or using the facility's formal grievance procedure doesn't solve a problem, a resident has other options under the law. One is to contact the long-term care ombudsman, who will investigate the resident's complaint and try to help find a solution. Another option is to file a complaint with the state agency in charge of nursing care facilities. Having a concern dealt with promptly, fairly, and without fear of consequences is an important right in itself.
You have a concern?
For residents and their families, it's important to know these rights and what the options are for getting a concern or grievance out in the open so it can be investigated and dealt with as soon as possible.
And I can start working on it right away to take care of the problem.
We've looked at what residents' rights are and at some of the challenges we face today in protecting and respecting those rights. You might want to pause the tape here for questions and discussion. What challenges are you facing? And what ideas do you have for making residents' rights a core value for yourself and your team? Now, before we close, here are some practical thoughts about the opportunities for change from our residents' rights team.
Well, I think the practical advice is to educate. Historically, there's this feeling like the nurses and nursing staff were the professionals and they knew what was best for people and they would make decisions. And I think what's happened over the years is that people have come to realize that they have a right to make decisions about what's best for them.
I think many caregivers sometimes are willing to be challenged to give better care if they're encouraged to do so, again, with kind of an openness of heart.
It would be helpful if family members put themselves in our shoes and know that we're here to help the residents, that we care about them, and that we're just trying to do the best that we can.
So everybody needs to be treated as an individual. There's a lot of residents here in this facility. There's 139 beds, but there's 139 individuals.
Well, we're all human and need certain things, and rights provide us with some of the things we need.
You guided everything, okay? If you want me, maybe I'll go and find out something, Chief, okay?
All right.
Okay.
So what does all this mean for you? We hope it's just this. Respect for residents' rights is an essential part of the important work you do.
But it goes along perfectly because resident rights have not changed. They have the same basic rights that we have living outside of the long-term care facility. Any right that you have in your personal home, they pretty much have in their personal home too. Is there a question? Yes.
Comment. I think that's one of the best long-term care resident rights videos we've ever had. So I'm gonna go on searching that out, find that out, regardless if it's dated.
Yeah, it doesn't change. I mean, I've been doing this 27 years. I've been in long-term care, and it's not changed from whenever I first started watching these very movies as a CNA to today. It's exactly the same. The laws, pretty much, like they were saying back in the day, before legislature came through and said, hey, this probably isn't good that we do this because one day we're going to be there, so let's change this. But the rights were for the facility and not for the resident, and so people came in and said, let's change it, and they have. And I encourage everybody to definitely keep it going, because someday we very well could be our very residents that we're taking care of. The most important thing that I can stress, if you have any additional questions about what is, a resident's right, it's posted outside my door. I can give you more literature if you're interested. But the most important thing I want you to take away is, if you feel uncomfortable, if you see something, if something just strikes you funny inside your soul, like, man, I don't know if I felt comfortable seeing that, witnessing that, hearing that, escalate it. Because once again, at any given point, it could be one of us. In those 27 years, I've taken care of 15-year-olds and 100-year-olds. So not much separates us. So definitely be the advocate that you would want somebody to be for you. And if it looks funny, escalate it. Go immediately to a charge nurse and start that process, because it's our duty for our elders to take care of them and make sure that they're happy and healthy spiritually, emotionally, in every way, shape, form, or fashion. So, I'm a little early, but does anybody have any questions or comments? Or all right. Well, I don't know where Kat is. I guess y'all can probably stretch after lunch. I know y'all are like, I'm sleepy. Thank you.
Okay. Oh, what? Start what? Oh, what are you talking about?
Just introducing the segment.
Really?
I have a couple of announcements.
Oh, okay.
Good afternoon. So we've got 2 more presentations. Patient safety is 2 to 2:30 about, and then a very brief presentation on the warehouse and supply ordering. Just a refresher again on the process. Probably take 5 to 10 minutes. Dan is really good at it. Thank you for bearing with us. We're close to the end, and don't forget to fill out your forms and leave them in the basket before you leave. And with that, I'll turn it over to Kat. Thank you.
He threw me off because he has